One of the problems and concerns with HAE patients and their families is often how long it takes to be diagnosed properly. It's a very rare disease. There's maybe 6,000 to 8,000 individuals in the United States with it. And so physicians learn about it when they go to medical school, but if they never see a case, they stop thinking about it. In the old days, patients would say it took 20 to 25 to 30 years before someone recognized what they had. In the last 10 years, that number has dropped to about 8 to 10 years, but still that's a long, long time to get a proper diagnosis. In a study that was published a few years ago, we found an average time from first attack to proper diagnosis of about 8 years. Typically, patients would see 4 or 5 physicians before getting the proper diagnosis, and many were given improper diagnosis. You have allergy, you have food sensitivity, you have irritable bowel syndrome. Typically, 25–30% would have unnecessary surgical procedures because no one could figure out why they were having recurring abdominal swelling attacks. The diagnosis is difficult to make if you don't think about it. If you don't know about a particular condition, you can't ask the right questions, you can't order the right laboratory tests, and hopefully through educational efforts like this one, we're getting the word out about this rare disease. Certainly in the allergy community, most of us, I think, recognize what hereditary angioedema is and what isn't hereditary angioedema and know how to properly diagnose it. But for the general practitioner, if you haven't thought about it, if they don't have a high index of suspicion, particularly if there's not a family history, oftentimes the diagnosis is missed. I recently saw a young woman who, interestingly, has a father who has hereditary angioedema, who knows he has hereditary angioedema. This young girl was having not only abdominal pain, but also joint pain, and was seen by a specialty hospital that works with rheumatic diseases in children. She had had a blood test, a C4 level, which is a screening test for the disease, and it was very low. They blamed that on a joint condition and never even thought that she might have some other reason for that low blood level. She came to my attention after she unfortunately went into the hospital and had abdominal surgery during one of her abdominal attacks. They found nothing and said, you know, maybe you're having a food allergy, go see Dr. Lumry and get it worked out. HAE stands for hereditary angioedema, so angioedema is the most common manifestation. Most patients will have swelling attacks involving their hands or their feet or their face, and many will also have abdominal attacks, and most have both. Both types are quite common. So usually what brings a patient to the physician is, you know, why am I swelling? What's causing this swelling? They don't have hives, they don't itch, but they swell. So that's what they're going to come into the emergency room with. That's what they're going to come to see the physician about. Rarely there are individuals that just have abdominal attacks and don't even mention swelling of their hands or feet. And those individuals are often very difficult to diagnose because you're looking for things that cause stomach pain and, again, don't think about the swelling aspect of it. About 25% of patients with hereditary angioedema have undergone unnecessary abdominal surgeries in an attempt to either treat their abdominal pain, find the appendix or twisted bowel or other thing that might be causing the abdominal obstruction, or to try to figure out what's actually causing the repeated pain. Most of these patients now are a bit older. We have better imaging techniques that are available in the hospitals, and if they don't see anything abnormal, then the surgeon's not called. But if you think about a patient that's having an abdominal swelling attack, they have a bowel obstruction. They look very sick. They've often been vomiting, so they're dehydrated. Their white blood cell count will be elevated because they're dehydrated. And if you find somebody with horrible abdominal pain, high white count, and looking really sick, you call the surgeon because there must be something terrible going on in their stomach. Typically, when an abdominal surgery is done, the findings are, well, there's swollen bowel here, but everything else looks normal. And so that should raise suspicion in itself. Why was this bowel apparently blocked? Whether at that point they're referred to someone who can make a diagnosis is hard to know, but typically in the case of the patient I was talking about earlier, after she had had essentially unnecessary abdominal surgery to find out why she was swelling or having pain, she was referred for an allergy evaluation because it must have been a food allergy that caused her problem. I think what we can do as an allergy community is educate our peers about this rare disease and how it can be manifest. That abdominal pain is a very common manifestation of hereditary angioedema. We speak with emergency room physicians, we speak with primary care doctors, pediatricians, and gastroenterologists, and obstetrician gynecologists, because all of those people are seeing this type of patient. Once they, again, put hereditary angioedema on their list of things that can cause this, then the road to a proper diagnosis is open. Well, hereditary angioedema is a genetic disease. It's transmitted through an autosomal dominant transmission, meaning that if your mother or father has the disease, then your chances are 50-50 that you're going to get the disease. Most patients with hereditary angioedema actually have symptoms. It's not a silent disease. 25% of the time, the mutation that causes hereditary angioedema, leading to no C1 inhibitor circulating or dysfunctional C1 inhibitor, is a spontaneous mutation. So those individuals won't have parents or grandparents that have hereditary angioedema. Their children, however, will have a chance to have it because they'll then pass the gene to them. We recommend that everybody in not only the immediate family but the extended family of a patient with HAE be tested. The reason being is that the first attack that an individual may have may involve their throat. And we know that if the throat closes up, your chances of dying are about 40% with this disease. So once we find an index case, if you will, a patient with the disease, then we go back and try to test everybody that we can get into the office. I think it's potentially a life-saving procedure.